Meanwhile, the Manufacturers Association of Nigeria says Nigeria risks losing more than 1 trillion naira annually in tax revenue with the proposed amendment to the National Tobacco Control Act. While the Medical and Dental Consultants Association of Nigeria and civil society groups in the health sector insist the proposed amendment is a good move to strengthen Nigeria's tobacco framework. National Assembly correspondent Joke Adisa reports.
Several health advocacy groups say the enactment of the National Tobacco Control Act in 2015 is a significant achievement for public health in the country. After almost 10 years in operation, lawmakers are proposing amendments they believe will further strengthen the act. This public hearing by the House Committee on Healthcare Services provides some contributions to the proposed amendments.
Are at all times ready to partner with relevant stakeholders and support any genuine effort required to improve the healthcare system in Nigeria.
Even though Nigeria has the highest gross domestic product (GDP) in Africa, the progress it has achieved in health has been rather slow and disappointing.
At the technical session, Manufacturers Association of Nigeria (MAN) cautions against enacting laws that will jeopardize the economic recovery drive of the President Bola Tinubu administration.
Nigeria is going to lose over $780 million that we have because there's a program in place for that industry to pump in domestic investment constantly over the period.
His views were rejected by many civil society groups in attendance. They insist there is no National Tobacco Smoking Control Act and therefore no basis for any amendments. The civil society organizations say human health must be prioritized.
The country is spending so much to care for this respiratory related, cardiovascular related, and many other diseases, including cancer, that are directly known to be caused by smoking.
There are new emerging products that are not captured under the National Tobacco Control Act. And this is an opportunity for the Act to now take a review of what is happening and the developing landscape of the tobacco industry to also bring those acts under regulations.
We recommend that the House retain public smoking areas in order to balance the respect and human rights concerns of the non-smoker and the smoker.
Lawmakers also allowed inputs from the public into a bill for an act to amend the National Insurance Authority Act of 2021. A bill for an act to establish the Institute of Health Service Administrator, sponsored by Edo lawmaker Billy Osawaru, also received inputs from professionals, many of whom lend support to the creation of the institutes. Joke Adisa, TVC News, Abuja.